are converting recovery process of two separate surgeries into one shot.
And that becomes a challenge because it's a young man with a tandem stenosis. Now, what is this tandem stenosis? So today's case becomes interesting because a lot of people come with low back stenosis, which is compression in the nerves in the lower back, what's traditionally called spondylosis, and they come with pain down the legs, which is what this gentleman has. But when you actually talk to them and interview them, you realize that they have some deficiencies in the upper limbs as well. So they are unable to, their dexterity is lost. They are unable to sign, unable to do fine motor function in the upper limbs. There's a 70% preponderance of people who have a lumbar spinal stenosis to have a cervical spinal stenosis simultaneously. The primary reason being that it's the same pathology and the same organ, and that gets missed. So our plan is to treat this person, together for both the problems, release the nerves in the neck and release the nerves in the back. And because we work in a team, Priyank, how do you think we are of benefit to this?
So I think the biggest advantage is that you are converting recovery process of two separate surgeries into one shot. So generally, maximum time it takes for a person to recover and fly out of the country is 4 months. It doesn't take more than that. So imagine if you have to do one surgery followed by other surgery. You might take 6 to 8 months for you to recover out of two surgeries. Plus the added issue of two admissions, two costing, twice taking anesthesia. So all of these are disadvantages in doing two separate surgeries. But on the other hand, doing both of them is important. That's the only way they'll get the desired outcomes. So the idea is to do both the surgeries simultaneously, and this is called as Tandem Spinal Decompression, wherein two teams are going to work on the patient together. One team addresses the neck pathology, other team addresses the lower back pathology. We free the nerves together. It happens simultaneously, so the anesthesia time is also not too much, and we have shown over the years that this is a very good cost-effective technique for a very good outcome, and that's what we are doing together.
And this is where VR Spine comes in, because we work as a team and we have several qualified surgeons on board. So we have 3 or 4 surgeons working at both ends together who are very, very reliable, and more than that, we have subspecialists. So we have a surgeon who does exclusively cervical spine surgery working on the neck, and someone who does redo lumbar working at the back. So two very high-end procedures can happen together without cutting corners. And I think that's the advantage of having a team. So we're looking forward to this operation. Actually, we've had the track record of more than 100 such surgeries done in the last 10 years. So that's tandem stenosis, yes. And that's the case. You can see on the MRI behind you. The compression is at both levels, and the target is to free the nerves above and below, so you get the patient up and running in a shorter span. Cheers.